Hi there, join me as I tackle the biggest mistakes people make with ceramic porcelain veneers and see if you can avoid them if it's something you're considering. Now, ceramic porcelain veneers have become super popular for transforming smiles, and it's easy to see why. They can completely change the look of your teeth, giving you that perfect Hollywood-like smile almost in an instant. As with any dental procedure, there are some common pitfalls that can lead to disappointing results. I'm Dr. Rachel Hall. I'm a dentist with over 30 years experience, and I'm going to share that experience with you to help avoid those pitfalls. Now, when you get, the thought of having veneers and you go through all the consult and you've seen all these beautiful photos, it's really easy to get caught up in all that excitement. You're going to be getting a new smile. You maybe have teeth that you haven't been happy with how they look for such a long time. And now you're like, whoo, I'm going to get this amazing smile that I've always dreamed of. But rushing into things without doing your research, that can be a big mistake. I've seen people go for the cheapest option without checking the dentist credentials, without checking that, they're going to get the right job, that they're even actually getting ceramic veneers and they're not getting like a pressed composite, which is nowhere near as nice as the porcelain. And that can lead to some problems down the line. You want to make sure that you're working with someone who knows what they're doing. It's very easy these days for dentists to load up their social media pages and their websites with all these incredible before and after photographs. Sometimes it's not even their work, and sometimes they don't have the skill that they're claiming that they have. A younger dentist who doesn't have a lot of experience may not be able to do your veneer case as well as somebody who's been around a little bit longer, such as myself. Can they show you cases? Can you actually maybe get a testimonial from one of their patients? I see a lot of patients, they go overseas to get veneers done because they think it's going to be cheaper and they're going to get a better job, and they haven't checked out the background of the person who's doing them. So do your research, ask around, do any of your friends or family have had veneers done? Does anyone you know have had the procedure? And then you can check with them who they saw and that they were happy. Always make sure you get more than one opinion, I would say. Another issue with cosmetic work in general, but particularly with veneers, are unrealistic expectations. Yes, they can make a huge difference to your smile, but they are not a magic solution. You need to have a good foundation of healthy teeth and gums for this to be successful. Now, in some cases, I had a case recently where we've got a patient who had very crowded, rotated and turned around teeth, and he wanted to have veneers. Now, he'd had veneers done previously with composite resin, which is like bonding a filling material on, and because his teeth were so uneven, some of the veneers ended up being very thick and bulky and overlaying his teeth and his gums and causing him health problems, and to be frank, they just didn't look nice. So he'd come to me asking for a solution, and I explained to him that the best way forward was going to be a longer and more protracted course of treatment. First of all, we needed to take his old veneers off, and we needed to straighten his teeth somewhat so that we could shape them and align them with the veneers without making things thick and bulky or having to drill tons of tooth structure away. So good on him. He went through 6 months worth of clear aligners. We lined his teeth up so they were much straighter and easier to work on. And if his teeth hadn't been discoloured, chipped and worn, that would have been a beautiful result for him, and we needn't have done any more. However, because his teeth were so discoloured and we couldn't address that with whitening, we went ahead and we did 10 upper veneers for him. So right from his smiling teeth at the back here all the way around to the front, and they looked fantastic. But if we hadn't moved his teeth, his expectations were unrealistic. I couldn't perform the treatment to get the results that he wanted without getting his teeth straighter in the first place. So there are things that need to be considered. Your teeth need to be healthy, your gum health needs to be in good condition. We need to address any decay, any infection. We need to look at your bite and constraints like that may cause problems going forward. Now, Another issue that I see is choosing the wrong shade. Not us, but you guys. This can make your veneers look unnatural. So many people want super bright white big teeth, and it just doesn't suit them. It doesn't suit their complexion. It doesn't go with the white colour of your eyes, which is a very good marker for what shade your teeth should be. And it can just look out of place. I mean, if your teeth have got a bit of a yellowish tint and you choose a veneer that's too white, it can end up looking fake, particularly if you're only doing, say, the front six, or you've got very dark lower teeth and we're not veneering or changing those as well, then your new ones are going to look really out of place. I mean, the idea is, I'm sure you want a smile that looks, really perfect, healthy and natural. We don't want them to look fake. Then there's the issue of neglecting your oral hygiene. If you're not taking care of your teeth and gums, then your veneers are not going to last as long as they should. If you don't look after them, you can get the risk of gum disease around them. That's going to make your gums look bad, but you can also get decay between the veneer and your tooth, and that's going to cause problems and issues. Also, if you don't keep them clean, they're going to stain and they're just going to look grubby and nasty. Now, I've stressed it before, but you must consult with a experienced and qualified dentist. They can help you figure out what veneers are right for you and guide you through the process, help you determine the shape, size, look of them, and what shades are going to be suitable. One of the most beautiful things we do now is we can take all these photographs, digital scans, and we can computer simulate and generate ideas of what the veneers might look like so that we can all be on the same page during treatment. Now, the most critical mistake that I have seen, and this can lead to disastrous results, is choosing the cheapest option, especially when it might involve having work done overseas without properly vetting and checking the clinic and its references. I've seen far too many cases of people where, hoping to save some money, they've ended up with really poor workmanship or low quality materials, and this just causes a ton of serious problems later on. The results can be painful, they can be damaging, and then they can be far more expensive to fix. And, we should have just done it right the first time. It's simply not worth the risk. I have seen some horrendous cases, and I've seen them on social media. When you have a veneer, your tooth should only be skimmed. Just a little bit of drilling to skim over the surface, just to make enough space for the veneer to see. I have seen cases where you look online and their teeth have been shaved down to these triangular little pegs. They've been completely annihilated and destroyed. What do you think that's going to do? It weakens the tooth. It means your veneer is going to fail. It means your tooth's going to crack and break, or your nerve is going to die, or all of the above, all for the sake of a cosmetic enhancement. And I see their before photos, and to be honest, their teeth weren't that bad in the first place, and now they have been irreversibly damaged. So please don't always opt for the cheapest option. It's not always the best. This is why it is super important to do your research, do your homework, find a reputable dentist, one who's got experience with ceramic porcelain veneers, and is also going to have a technician that they're used to working with, who they know can deliver on results. A qualified professional is going to deliver a beautiful result, but they're going to also protect your long-term oral health. So to recap, the key mistakes to avoid are poor research, unrealistic expectations, choosing the wrong shade, neglecting your oral hygiene, and not consulting with an experienced dentist, and taking your time during the process to work together to make sure you're going to get the result that you would like. When done correctly, porcelain ceramic veneers are beautiful. They can give you a superb, natural looking smile that boosts your confidence, and Who doesn't want that at the end of the day? Now, if you've had any experiences with veneers, good or bad, then please do share them in the comments below. I'd love to hear about it. And if you're interested in learning more about dental care, be sure to check out some of my other videos over here. Do like, comment and subscribe, by the way.